Diabetic-related foot disease, what options do I have? Diabetic peripheral artery disease, PAD, is a complication that often arises in individuals with diabetes. Peripheral artery disease refers to the narrowing or blockage of arteries outside of the heart and brain, usually in the legs and feet. When this condition occurs in people with diabetes, it's often referred to as diabetic PAD. Here are some key points about diabetic PAD. Causes: diabetes can lead to the development of PAD through several mechanisms. High blood sugar levels can damage blood vessels, causing them to become stiff and narrow. Additionally, diabetes can lead to inflammation and the accumulation of fatty deposits, atherosclerosis, in the arteries, further restricting blood flow. Common symptoms of diabetic PAD include leg pain or cramping, especially during physical activity. This pain typically improves with rest. As the condition progresses, individuals might experience pain even at rest, non-healing wounds on the legs or feet, and decreased hair and nail growth on the affected limb. The risk factors for diabetic PAD are similar to those for regular PAD and include age, smoking, high blood pressure, high cholesterol levels, and a family history of cardiovascular disease. Having diabetes significantly increases the risk of developing PAD. Diagnosing diabetic PAD involves a combination of physical examination, medical history, and various tests. Ankle brachial index (ABI) measurement, Doppler ultrasound, and angiography are some of the tests that doctors may use to assess blood flow in the affected limbs. Okay, so this looks bad, but what can I do to combat this issue? We have some therapies to share, but would you please give this video a thumbs up and subscribe to Type 1 Diabetic Warriors? Your support helps this channel tremendously. Now about treatments. Treatment for diabetic PAD aims to manage symptoms, improve blood flow, and prevent complications. Lifestyle changes, such as quitting smoking, adopting a healthy diet, and engaging in regular exercise, are essential. Medications like blood thinners, antiplatelet drugs, and cholesterol-lowering medications may also be prescribed. In more severe cases, procedures such as angioplasty, with or without stent placement, or bypass surgery might be necessary to restore proper blood flow. Blood flow is key. Just like the rest of your body organs, your legs and feet need arteries that are unobstructed with plaque. This same plaque that we hear so much about regarding our hearts is just as destructive to our legs and feet. The American Diabetes Association recommends, among other things, washing your feet every day, especially between the toes. Check your feet for sores and cuts. Remember, as our blood sugars become out of control, it's always harder for wounds to heal. If left untreated, diabetic PAD can lead to serious complications. Non-healing wounds can become infected and potentially lead to gangrene, which may necessitate amputation. Moreover, individuals with diabetic PAD have a higher risk of heart attack, stroke, and other cardiovascular events. Friends, if you are seeing a pattern with treating diabetes, it always comes down to managing your blood sugar. We as Type 1 diabetics need this as a fireman needs water to fight a fire. Everything bad that comes from Type 1 diabetes comes from high blood sugar. Managing diabetes effectively through blood sugar control is a critical aspect of preventing diabetic PAD. Regular checkups and early intervention are important to identify and manage risk factors. It's important for individuals with diabetes to seek treatment and prevention solutions by working closely with their healthcare team to monitor and manage their condition, as well as to take steps to reduce their risk of diabetic PAD and its complications. You need to be proactive by educating yourself in great detail about this disease. Type 1 diabetes stinks, but thankfully you can control it and lead a normal life by getting help. You can do this. Thanks for checking out our video today, and look for more content like this soon. In the meantime, be well.